The majority of Americans state that they wish to die at or near home. However, a significant proportion end up spending their last days in the hospital. My name is Rachel Hadler, and I'm an anesthesiologist, intensivist, and palliative medicine physician at Emory University. My research is informed by problems I identify in my practice, and I'm particularly interested in answering questions of how and why people end up dying in the intensive care unit rather than in their communities. My 2023 FAER Mentored Research Training Grant is focused specifically on those patients who die within 3 days of being transferred between hospitals, a problem which we describe as early mortality after transfer. These individuals tend to be older and to be quite ill when they arrive at the hospital, and many travel long distances to ultimately receive comfort-focused care that could potentially be provided in their home communities. Pre-transfer discussion of mortality risk and how transfer may or may not align with an individual's wishes for their care is rare, suggesting that communication gaps may be a modifiable contributor to this outcome. In my current work, I'm capturing how clinicians make decisions around interhospital transfer at end of life, and how early mortality after transfer impacts patients' families through a mixture of quantitative and qualitative methodologies. I'm also using a large national dataset, the National Readmissions Database, to examine the other impacts transfer may have for high-risk older adults, including upon hospital readmission and on fragmentation of care. This work will educate future studies to identify strategies that can help hospitals and clinicians provide more patient-centered, goal-concordant care for older adults who face high-stakes decisions around serious illness care. I'd like to thank FAER and the ASA, as well as my mentorship team, for supporting this work and that of other grantees.